Hi, everybody. I wanted to talk to you today about the pain scale. Dun, dun, dun. The thing that everyone feels like they need to defend themselves against when they go to the doctor as a physical therapist or anything like that. And the doctor says, on a scale of 0 to 10, tell me about your pain. Tell me where your pain is. And almost every single person says, well, I have a really high pain threshold, or I have a really low pain threshold, or they start with an automatic defense of their own pain threshold, so that they can feel justified in whatever pain they're reporting. And to the point where even some people feel like they're not going to be taken seriously if they give an accurate report of what their pain is. And so it becomes sort of falsification of what their pain is. So you get the people who are clearly visually in significant pain, who are saying that they're at a 2 or 3, or you have people who are, again, also clearly in pain, but saying it's a 20, it's a 30. Because for whatever reason, and probably for very good reason, probably because people don't get taken seriously when they say they have pain, or they don't have the accurate words to describe the type of pain they have, and so their provider doesn't understand what their pain is, because there are different descriptors for different kinds of pain. When you talk about nerve pain, you can talk about pressure, or you can talk about a burning, or you can talk about a tingling. Um, Whereas you talk about muscle pain and you say, oh, I push on it and it feels bruised. So there are definitely different types of pain. Not what this video is about. This video is about the pain scale. Um, but having said that, I am here to assure you that the pain scale is used by practitioners. Not all practitioners. I can't speak for everyone. I can speak for physical therapists. Most of physical therapists. We are using that to gauge your pain against your pain. So if you come in and tell us that you have a 10 out of 10 pain, 100% believe you. I have no questions about that. This is the worst pain that you've ever had in your life. And you're the only one who has ever lived your life. And so you're the one reporting on how the pain is in your body at this point in time regarding this injury. That's not to say that the next time you were in pain, you might be a 10 out of 10. Um, and that might be worse than this pain, which makes it also the worst pain you've ever had in your life. Um, the pain scale is subjective. It is you reporting to us on your pain. So your 0 might not be my 0. Your 0 might be my 3. Your 0 might be my 8. But I am not recording and reporting on my pain. I am recording and reporting on your pain. So when we ask you on a scale of 0 to 10, how bad is your pain? 10 being the worst pain you've ever had, 0 being no pain at all. I want you to be candid about your pain in this moment. If you're pain free, we might ask, like, over the last 3 days, what is the worst it's been? We're just trying to get a picture of the overarch of the injury. Does the pain come and go? Have you noticed that at times it's a 7, but right now it's a 4? Those are all valid questions. Now, the entire reason that we're asking this is not only to get an exact picture or a really good picture of what's going on with you now, but we like a good benchmark. We like to see where it's going and how it is, in a matter of days, weeks, months. So if you come see us for the first time and you're in 10 out of 10 pain, and we listen and we figure out what's going on and we really work at it, and we're doing our manual therapy and we're doing our exercise and you're doing your home program, and we're not managing the pain in an expected way. If week 1 you say it's still a 10 out of 10, and week 2 you're saying it's a 9.5 out of 10, and week 3 you're saying it's a 10 out of 10 again, we know that we're not affecting the pain in the way that is expected, um, both by you but also by us. We have experience in our field to know that when we do certain, uh, excuse me, when we do certain actions, when we do certain treatment styles, when we're doing the plan of care that we've designed for your specific injury, we can expect these certain outcomes within a specific amount of time. And so we're judging how well our treatment is working based on your outcomes. And so we're only comparing it to you. So saying like, compared to other people, I have a high threshold, and then um, the pain doesn't move, then it's still not moving pain. It's still your pain. Your pain is the specific pain that we're concerned about in your case. And so we want to make sure that we're doing everything in our power and under our ability to affect that. I really hope that makes sense. So if we need to pivot our treatment based on a lack of change in your symptoms, we can do that accurately by comparing you on day 15 to you on day one. Um, just like we would in a functional activity, say day one, you can't do stairs, and day 15, you can do 3 stairs. That's a big improvement. Whereas if day 15, day 30, you're still unable to do stairs, then we have to pivot pretty sharply on what our treatment is, and or that we need to send you for additional assessment by a different part of your health team to figure out if there's something bigger going on. So I think people get nervous that they're going to be judged if they have too much or too little pain, or that they're not going to be taken seriously if they have too low or too high pain. And I think sometimes they get caught up in what that question means and what that question is about. And I would just like to assure you, we are looking for your pain to both assess what's happening in the immediacy of the now when we meet you, when we do that initial evaluation, but also so that we have an accurate benchmark to compare to as we progress our treatment and you get better. And if you don't, we have valid data that is specific to you that we can use in our justification for getting additional assessment. So if you have any questions, just throw them my way. I'm happy to answer them. But I wanted to take a minute because that question came across me 3 times this week. So there it is. All right. Bye, guys.